What up, guys? It's Leo here, and I made this vid real quick just to maybe put our animosity at ease, to bring that stress level down regarding COVID-19. We know the CDC came out and stated that 96% of the people that died from COVID-19 had an underlying condition, meaning that only 6% that died were straight COVID patients. But the video right here is from Dr. Ezike, and she's the director of the Department of Public Health. And she states that in a lot of the cases, or let me just say, I'll give you an example. If a patient was in hospice, and we know with hospice, you typically have 6 months or less to live, that when they passed from their disease, and if they had COVID-19, then it was chalked up to being a COVID-19 death. So I just want to say, protect yourself, wear your mask, wash your hands, keep 6 feet. I'm not saying, if you're worried, don't disregard any of that. But I would say, take a look at the science, follow the science, and I think this should make us at least a little bit more at ease. So, roll the tape.
I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.